Hello, everyone. I'm Dr. Carmen Puliafito, and I'm here today with Dr. Mark Barakat. Mark, welcome back to Retina Synthesis.
Thanks for
We're
having
going to
me.
talk. It's great to have you. You're really someone who's at the cutting edge of retinal pharmacotherapy. Uh, so we're going to talk about the Reclaim 2 trial today. What is the Reclaim 2 trial?
So the Reclaim 2 trial looked at testing a compound called Elamipretide. The basic premise is this. We know we have two compounds that are FDA approved for the treatment of geographic atrophy, and they work maybe 20, 30, possibly even 40%. I think we can all agree we're still missing a portion of how we can best address geographic atrophy. So look at different mechanisms of action. And so what this compound does is it addresses the issue with mitochondria. The retina in specific has a very high energy demand, needs a lot of ATP, thus you need a lot of mitochondria. We know with time, with age, and frankly, even more so in the presence of AMD, your mitochondria break down, the inner membranes of the crista, the folds actually break down. And what this compound does is reforms the correct structure, if you will, of the membranes of the mitochondria. What that all means is it enables the aging mitochondria to produce ATP at more normal levels. And so in the phase 2 trial, this compound, Elamipretide, was given subcutaneously. And what they looked at is of course, progression of geographic atrophy as a primary endpoint. Unfortunately, did not meet the primary endpoint. However, it did show about, somewhere between 43 and 47% reduction in ellipsoid zone degradation, whether it's partial or complete. So it looks to have some sort of a protective effect on the photoreceptors, which makes sense because if you think about it, there's a lot of mitochondria there because there's a very high energy demand there. In addition to that, it also showed the potential of preservation and in terms of visual acuity preservation, in terms of two-line gainers and preservation of loss. So that's actually quite exciting.
What kind of geographic atrophy was evaluated?
So I don't think they really looked at whether it was foveal involving or not foveal involving. I'm not 100% sure on that, to be honest with you. I think they just looked at it as a phase 2 to kind of see, is there a biologic activity? And I think this is a great example of not all phase 2 trials have to hit their mark. It's about exploring the compound and getting an idea, is there potential there? And they saw potential in terms of easy preservation.
Where was the EZ preserved? At the edges of the geographic atrophy or elsewhere?
Well, so they looked at ellipsosome generally speaking, but yes, so the theory is this. We know there's a feedback loop between RPE loss and photoreceptor loss. And one of the theories that we currently are investigating is you have an area of geographic atrophy, complete loss of everything, RPE loss as well. And on the edges of that, you have complete ellipsoid zone loss. And on the edges of that, further out still, you have partial loss. So the partial loss precedes, is the vanguard, then the complete loss follows that, and then afterwards you get the RP loss. And the thinking is if you can have something that preserves the ellipsoid zone, and then you reduce complete loss, reduce partial loss, you then can fence in the geographic atrophy. Now that may take more time, but then you actually save photoreceptors and you could potentially save vision.
That's wonderful. You at the meeting in Hawaii where you discussed this, you had a little diagram of an expanding and contracting circle. Can you describe that and what it meant?
Right. No, absolutely. So think of a almost like a dartboard, right? And the bullseye of that dartboard is not. We're not talking the fovea here. Just as a center of the lesion, and the center lesion is the loss of the RPE, and on the outer edges, right, the next ring around that is complete ellipsoid zone loss, but you still have some RPE left. And then on the outer edges, where things are meeting functional retina, you just have the beginnings of ellipsoid zone loss. So we think that those areas are the ones that are slowly spreading. And this compound has the potential to slow down the outer rings. If you slow down the spread of the outer rings, even if the inside ring of the RPE loss expands, it cannot expand beyond the outer rings because there's a feedback loop. If you have healthy photoreceptors because their mitochondria are enabled, then hopefully it will keep the health of the RPE cells there intact as well.
That's great. Now, this has been a subcutaneously delivered drug every day, which is a great treatment burden for the average patient. But you discussed a, a different delivery method. Can you discuss that?
Sure, absolutely. So, I mean, the pros and cons with subcutaneous delivery, of course, right? The upside is that you treat both eyes. The downside is it is subcutaneously given, and there's a treatment burden as well. And so, what they're doing is they're actually looking at a different compound called Elamipretide, same mechanism of action given topically. And what they've actually shown in preclinical models is that you have the same ocular tissue exposure and the same ocular tissue concentrations in the RPE and choroid in the retina as the subcutaneously given Elamipretide. So right now, this compound is in phase 1 trials. And it's actually very exciting to see if finally we can have a topical treatment for geographic atrophy.
This is all very interesting. What's the company's development strategy?
I mean, so right now they had one phase 3 trial for the subcutaneous Elamipretide, and we're expecting results of that in the near future. That will help, frankly, it help guide us to see how well the compound works, what the concentrations are, the effect on low luminance vision, on the photoreceptors, and that will actually help guide their topical compound development as well. So you're going to have some very well vetted data on the mechanism of action, and I think it's a solid pivot towards the topical compound.
Wow, that's exciting. This is a step in the right direction.
Certainly hope so.
Thanks a lot, Mark, for joining us.
My pleasure, as always.